In recognition of American Heart Month, Penn State Hershey Heart and Vascular Institute presents Heart to Heart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rose. Thanks for joining us. Cardiovascular disease is the leading cause of death for both women and men in the United States. Women can experience the early warning signs of a heart attack up to a month before the actual attack. Now, tonight, one day, a State College woman was celebrating at her baby shower. The very next day, she was fighting for her life and the life of her unborn baby. Here's her story.
This is a typical day for Mel Saylor. She owns a pet sitting business.
I work with dogs and cats. We do midday walkings for people who have full-time jobs and can't get home, and we also do care when people are out of town. Ready? Yeah.
On this day, Sandy, a Sheltie mix, needs to spend some time outside and play.
Good girl.
Mel's daughter, Kiriana, is by her side to help. Kiriana just turned 3. A happy time. It's also a time that brings back bittersweet memories for Mel.
It was a scary time that I'm obviously reminded of whenever I look at her and try to be as thankful as I can for every day that we have, because you don't know.
It was more than scary. Doctors say it was life-threatening. Mel was 8 months pregnant. A day after her baby shower, she went to an emergency room at State College because of shortness of breath.
Well, they took me by ambulance to Hershey, and then once I got there, they checked everything out. They tried some different medications that were still safe for her the first night, but really nothing that was safe for her worked.
It was bad. We were concerned for both mother and child, and it was a life and death situation.
Dr. John Boehmer at Penn State Milton S. Hershey Medical Center says Mel's heart was failing because of an arrhythmia, an abnormal heartbeat.
She was already in some degree of shock. She had a heart rhythm disturbance that was likely leading to her heart being weak. Essentially, her heart running too fast for too long and eventually getting tired. Now, her baby was at risk of dying in that situation because you're not getting enough blood flow to the uterus and to the placenta. And her organs were beginning to show some ill effects of not having enough blood flow. So she was at the point where her body was starting to shut down. We could have lost both the baby and the mother as a result of those complications.
Dr. Boehmer says Mel's baby needed to be delivered immediately.
They basically said, you know, our concern is both of you. We want the situation best for both of you, and in order to try to help you, we need to take her.
Kiriana was born a month early on January 23, 2007.
They did have the, I guess, prenatal team or whatever when they did the C-section there waiting for her to make sure, but she was able to go straight to regular nursery, so that was good. I was happy, you know, that everything was fine with her, but at the same time, there were a lot of things that I had wanted to happen and that couldn't. I had a hard time even holding her because I was hooked up to so many things.
Such a special time, surrounded by so many complications. Mel's baby was healthy, but she wasn't. Her heart only got worse.
An amazing story, and we'll show you the conclusion of Mel's story in just a few minutes. Well, joining us now in the studio, Dr. Soraya Sami. And Doctor, what causes, from your experience, what causes the arrhythmia that we saw there with Mel?
Oftentimes people are born with a condition that predisposes them to rhythm problems and susceptible to sustained arrhythmias. Sometimes they can acquire them.
Well, it seems like the first thing I thought of when I saw that a woman in her condition would deny everything.
Right,
so
right.
That has to be somebody else.
Right, exactly. And she also she was pregnant. It was hard to tell what was being shortness of breath from pregnancy or from another condition.
Right. Well, what kind of health problems can we see from arrhythmia? What happens?
Well, oftentimes people present with palpitations or the sensation of their heart racing. Sometimes they can have dizziness or lightheadedness and even passing out. I think the story of Mel is not typical. It's more of a rare form.
Well, I saw at the opening of the show now, I mentioned that there are heart attack symptoms for a woman different from a man. What are some of the signals, the early warning signs that a woman should watch for?
I think what's important for women is that they recognize that they are at risk, and that if they have symptoms that are out of the ordinary, that they should consider a heart problem as being a cause as possible.
Yeah, sometimes I think that's a man's problem.
Right, and they'll just blow it off as something else.
Yeah, that's it. Well,
here's our first viewer question. I'm a 63-year-old woman and have had a family history of heart problems. I've often had excruciating pain throughout my chest, back, up to my jaw, and down my left arm. I've had several stress tests and a heart catheterization that showed nothing wrong. What could this be?
Well, it certainly does sound like it could be heart pain, but you say that it's already been worked up well, and it was not found to be heart pain. So you need to still figure out what the pain is, and so it could be something gastrointestinal. So you need to follow up with your doctor and see if it could potentially be gallbladder, stomach, esophagus, something like that.
And follow-up is good, just like what happened today with former President Clinton. He was admitted to the hospital.
Certainly. He had some chest pain, I understand, and sought help and actually needed to have 2 more stents put in. So that was definitely the right thing to do.
Okay, great. Thanks so much, and we'll check back with you just a little bit later. So Chuck will send it back to you in the studio.
And thank you, Deborah. And when we come back, we'll show you the conclusion of Mel's amazing story.